Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Streptococcal pyogens, and we are looking at the cutaneous infections and the diseases. So in streptococcal pyogens, first we look at the direct infections of the skin and the subcutaneous tissue. So direct invasion of the skin as well as subcutaneous tissue. So this includes the presence of cellulitis. There can be impetigo. Next is there may be estheima as well as the erysipelas. Then is the vulva vaginalis. So there is vulva vaginalis, there is perianal infection. Then comes the staphylococcal infection, SC infection, staphylococcal infection. The blistering distal dactylisis, the blistering distal dactylisis. Then comes the necrotizing fasciculitis, necrotizing fasciitis. So all these are direct invasion of the skin and the subcutaneous tissue. Next is the secondary infections. The secondary infection, there will be presence of the eczema. So there is eczema, there is infestation, there is also presence of the ulcers. Then let's look at the tissue. So tissue damage. So tissue damage from the circulating lesions, circulating toxins. So this will include, so all this we are talking about the Streptococcus. So it includes the scarlet fever. Scarlet fever. Next is the toxic shock syndrome. The toxic shock like syndrome. Next is the recurrent toxin mediated perineal erythema. So there is recurrent toxin mediated perineal erythema. Next we look at the skin. The skin lesions due to allergic hypersensitivity to the streptococcal antigens. So this will include the erythema nodosum, next is the vasculitis. Next is we look at the skin diseases provoked or influenced by the streptococcal infection. So we look at the skin diseases which is provoked or influenced, by the streptococcal infection, and the mechanism is being uncertain. So it includes the psoriasis and especially the guttate forms. The psoriasis, especially the guttate form, and it also presents as there is a Kawasaki disease. To learn and grow daily like this, please do subscribe.